Oh, why are you so early? What's wrong with you?
I don't feel good today.
What's happened here? Sit down here. Wait. You sit down here. What's happened to you? What's wrong with you?
I feel sick.
Really?
I feel hot and
Oh, it's
You
so
know-
hot. Where is
You know-
thermometer? Where are you
Look at
placing
my-
there? Oh,
look
here.
at my fingers.
Is it blood?
It's
Oh, your
different
face.
color. Even my
Oh,
toes, it's so darker. I don't know why.
Oh, yeah. Just measure the thermometer.
Do you think I'm okay?
Yeah, you will. Wait. Oh, 39.9? How come it is so high? Just go to the hospital. We will just go to the hospital, huh? Okay. Let's go. You stand up. Please try to stand up. I can't, I can carry you. Wait. Yeah. What's happened to him? I don't know. Please help. Nurse, please help. Slow. Happened to my husband. What's wrong with you? Where is the doctor?
That's cool. Can you?
Chaw Thi, look worried.
How much is it, nurse?
90/50.
1950? Is this normal or what?
Excuse me, ma'am. I have some interview. What's the name of your...
Yoo Min Woo. What's the diagnosis of my husband?
We will ask with the doctor. Can I know the chief complaint of the patient?
4 days ago, he told me he is experiencing heavy breathing, and then the lips are aching, and then he is coughing, and then he has a serious pain, and then he experiencing the color of the fingers and toes are changing into black. And before we came, I measured the temperature is 39.9, and on the way here, he started chilling. And then I noticed 2 days ago, I said he has chief complaint for the pain under the armpit, and then before I came here, I found it out it is swelling under his armpit.
Is this the first time happened?
Yeah, this is the first time he has those kinds of serious, temperature and those kinds of complaint. Before it, he doesn't have anything. Well, is my husband condition is so serious?
Well, ma'am, we will follow up with the doctor first.
Okay.
Okay, I'll be back.
Okay, thank you. Where's my husband?
Ma'am, we are still having laboratory tests for your husband to confirm what the diagnosis really is. But we have made a tentative diagnosis and it is a bubonic plague.
Is that
Let's go to my office.
what is bubonic plague, though?
Bubonic plague is an enzootic infection that results in lymphadenitis and fever. In the 14th century, this is called the Black Death, for it has secured a place in history as a devastating epidemic that affected 1/3 of the population of the Europe.
What are the causes, though?
It's commonly caused by Yersinia pestis, a gram-negative pleomorphic bacillus that is a part of Enterobacteriaceae family. This virus is commonly transmitted from the fleas to humans. The fleas bite the humans. Usually, rodents as well as dogs, cats, rabbits can thereby act as a reservoir to this infection. May I ask, where do you live?
Down here, Doc, under the PK bridge, we have a makeshift house, and we reside there with others.
Your environment could have placed your husband at risk. What is your husband's job?
He is an MBA. He cleans the environment and chemistry. I noticed that his symptom is evident for his own. How long will it take the symptom will be occur after being bitten by the fleas?
It's usually 2 to 6 days between the exposure and the first presentation of the symptoms.
Doc, excuse me, can I talk to you for a second?
Excuse me,
Cut. Doc, actually something of stomach ache, and the baby is going down.
What is the BP?
From 120 over 80, it's become 80 over 50.
80 over 50?
Yeah.
Hi, good morning. Welcome back to TV3 for Ang Balita. Now I'm in front of the Silang Adventist Medical Center, and today I'm going to have a one-on-one interview with the president of Silang Adventist Medical Center. Ma'am, may I have an interview about the recent epidemic here in your place?
Okay, sure.
So this morning we are very fortunate because today we are going to have a one-on-one interview with the president of the Silang Adventist Medical Center. Ma'am, I heard there is this epidemic that is scattering in your place. What is it called?
It's called the bubonic plague, and it comes from infected fleas from rodents, cats, dogs, your pets usually. And the signs and symptoms when they appear, there are aching limbs, you have a cough, you have pain, and eventually it leads to discoloration of your fingers, toes, a black discoloration, and then the bites that come from the fleas, the infected fleas, most especially in the groin, armpit, and neck area, they grow up to 10 inches, and they're very, very painful.
So what should they do when they are experiencing this kind of signs and symptoms?
Well, usually, I guess there are body malaise and fever. They should, once that occurs, they should rush immediately to the nearest clinic or the hospital so that they can be tested for the bubonic plague.
So right now, how many cases do you have in this hospital?
So far, we've had a number of 208 cases, but because that's a lot. But because of they came late. They came like once they started to, after maybe 4 days of having those fever and chills and body aches. It's too late to cure it. So usually the outcome is pretty good once you find out what it is. But then once it's delayed, the mortality rate is very low.
So what can we do to prevent this?
What can you do? Well, you should, because since it comes from infected fleas, anyone who has pets or lives near a canal or a sewer or any place that has a lot of flies and animals, they should always wash their bodies, put on insect repellent, and for their kids, they should make sure they go out. They should take a bath daily so that the fleas won't bite them.
Okay, doctor, last question. When you are infected by the virus, what are the treatments?
Well, once we suspect that it's bubonic plague, antibiotics are given. So, and at the same, for example, geromycin and streptomycin, those are the examples of antibiotics that are given so that they can fight off the plague.
Okay, so our fellow citizens have now learned about this bubonic plague. Do you have any messages to our friends who are watching right now?
If anyone you know, or if you seem to notice that you start to feel tired, you have body aches, and you have these weird bites on your body, please rush to the immediate clinic or hospital that you live, so that we can prevent the bubonic plague from further affecting you.
Okay, thank you so much, Dr. Esperat, for giving us a bit of your time. Thank you. So, now that you fellow citizens already know about the bubonic plague, let us do our best to prevent the epidemic and save not only our lives, but our loved ones' lives. So, back to you, Miss Gilden Galang.
The bubonic plague is caused by deadly bacteria called Yersinia pestis. Inside both John and Lucinda's bodies, the plague bacteria invade the lymph nodes, causing them to swell. These are called buboes. If the bacteria get into the bloodstream, they clog the arteries, often ending in death.
The bubonic plague is highly contagious. The first reported plague pandemic was in the 6th century of the Common Era, and it has killed well over 150 million people worldwide. Without treatment, the bubonic plague kills 50% of those infected.